Good afternoon, Beth. My name's Jo Brown. I'm a clinical education practitioner and I'm going to be one of your assessors today for CT19, which is your OSCE for cardiac. We've got Lou Bamford and we've got Chris Hyde as well. So, can you introduce yourself, please?
Yeah, Elizabeth Finney.
I thought you forgot your name
I
then.
know.
Elizabeth Finney.
Elizabeth Finney, and I'm an apprentice EMT.
Yeah, perfect. So today's date is the 1st of October 2024 and we are going to be, as I say, assessing you on this scenario. Are you happy to go ahead? Everything okay?
Yeah.
Yeah, you feel alright. And can I just ask you, you have blind picked this scenario that you're about to embark on?
Indeed.
Yes? Okay. So I'm going to read this to you and then you'll talk us through it. You are part of a EMT1 crew and you've been dispatched to an office block in response to a 999 call for a patient experiencing chest pain. Upon arrival, you find a 54-year-old male named Mr. John Smith. Your objective is to assess and manage the patient in line with trust protocols, ensuring his safety and providing appropriate care. Now I'm your patient, so when you're ready, any questions about the patient on the presentation, ask me.
Okay.
Okie dokie, when you're ready, Beth.
Okay. So upon approaching the scene, I'm going to be doing my DORA. It is an office block, so I'm going to be looking at my egress and exits and making sure that there's no scene safety issues, nothing that I could slip, trip or fall onto. I'm going to don my PPE. There's no special precautions in place at the moment. I've got clean hands and I'm not wearing gloves. So, hello, my name's Beth. I'm from North West Ambulance Service. I'm going to note the patient and looking at their colour and their positioning.
Okay. Pale. So it's safe to approach, yeah. Hi, my name's John. Hi.
Hi John. So what's the reason for the call today?
So I've got some chest pain.
Okay. Right. Now, is it in the centre here where you're rubbing?
Yeah, it's right in the centre of my chest.
Okay.
Here.
And were you doing anything when this happened?
No, I was just sat at my desk. I was just reading a few emails and I got this in my chest.
Right.
Yeah.
Okay. So how would you describe this pain, John?
Do you know what? I describe it as like a pressure, you know, like an elephant sat on my chest.
Right.
It feels very tight as well. Yeah. Yeah.
So you weren't doing anything out of the ordinary
No,
to cause this pain?
Just sat here reading some emails, yeah.
Can you just feel it in your chest or is it anywhere else?
It's like in my left arm, and it's right into my back as well. Seems to be going radiating around.
And any fainting, any nausea?
No, I've not fainted or dizzy or
You look
anything.
quite pale to me. Is that different from normal?
No, I don't feel well. Am I gonna die?
No, don't worry at all, John. We are going to help you.
Oh.
Okay, when did this start? What time?
About an hour ago now.
Okay.
Oh gosh.
Is anything helping it?
No, it's getting worse, I think.
Anything making it better?
No,
Okay.
it's getting worse.
Okay. So I'm going to do some observations on you, John, if that's okay.
Oh yeah, gosh, it's so painful. Yeah. Oh.
Do you have any medical history that I need to know about?
About 4 years ago, I had some stents fitted. I had a similar episode.
Right.
I've been fine since. I've had no problems.
Do you know why they fitted those stents? Was it
I
explained?
have an angiogram. I don't know. They didn't say what it was.
Okay.
But I have got like high cholesterol and high blood pressure. I am diabetic as well.
And after they fitted these stents, did they put you on any medication?
Just for me, high blood pressure, so like bisoprolol. I'm on statins and some metformin as well.
Okay. Am I okay to pop this on your finger?
Yeah, sure.
It's just going to measure your
Thank you.
sats.
So my sats on room air are 95%.
95, okay.
Ooh.
And I'm just going to do a temperature as well.
Okay, that's 36.9. Oh.
And I'm going to do your blood pressure.
So that's 150 over 90. Oh dear gosh. Takes your breath a minute. Alright.
So am I okay to just check your pulse?
Oh yeah, thank you. So my pulse is 94 beats per minute.
Okay. And whilst I'm doing your pulse, I'm just going to check that you respirate as well.
Okay, my respirate's 22.
Could you just repeat your pulse, please?
My pulse is 94. Ooh.
Okay, so John, if it's okay with you, what I'm going to do, I'm going to do an ECG
Okay.
because we need to have a look at your what your heart's doing at the moment.
Okay. Oh.
So after looking at the saturations are all okay. Don't need to administer oxygen at the moment, but I'm going to monitor.
So would you be able to do an ECG and put placement of that on the mannequin? Oh gosh. Takes your breath away, this pain.
On a scale of 1 to 10, so we're going to measure it, 1 being a little niggle, and 10 being the worst pain you've ever experienced.
It's got to be a 9.
A 9?
Yeah.
Okay. Have you taken anything for your pain at the moment?
No, I haven't taken anything, no, because it doesn't know what to do, no.
So at this point I consider Entonox. There's no need to put on oxygen at the moment, so breathing's all okay. And I think Entonox would be a steady pain relief.
Okay.
Okay.
Am I just taking this?
With me, I'm just going to check my JR calc before I give it you. Make sure that. I'm just going to check my contradictions and my cautions as well. So there's been no injury to your chest at all?
No, I've just got this pain, no.
Yeah, so if you just take steady breaths on that Entonox
Okay.
for me, that'd be fantastic. Whilst I do this ECG.
Yeah. Will this help the pain relief?
Yeah, it should do. Whilst John is using Entonox, I'm going to call for backup and the OSCE. I'm suspecting this is cardiac chest pain, and I'm also suspecting that this patient will be needing to go into hospital as well.
Oh, it's hard, isn't it, to do this?
Are you finding that difficult, John?
Just because my chest feels so tight, you know, it's really quite painful, you know.
Would you prefer if I gave you some paracetamol instead? Would that be easier?
There's no reason I can't have paracetamol, yeah. Thank you.
I'll just pop these leads on and then I'll get you some paracetamol.
Oh gosh, it's pain.
So I'm going to put one on the furthest.
You've got the positioning right anyway.
Yeah, thank you. I'm going to do chest leads. So.
Gosh, I feel really clammy.
You feel clammy?
Yeah. Oh. A bit warm in here. Oh. Sweating. Oh, this pain.
Okay, John.
Oh, it's
We're gonna get you some help, okay?
yeah. Thank you.
So, my first lead on the ECG, I'm going to go down 4 intercostal spaces, so 1, 2, 3, 4, and pop that there in the intercostal space, not on the bone.
Yeah.
And then I'm going to go opposite
Yeah.
on the other side of the sternum,
Yeah.
in the same place, in the intercostal space.
Okay.
Then I'm going to place number 4 next. I'm going to go mid-clavicular, down,
Yeah.
normally just under the nipple, but that does differ
Yeah.
in the next intercostal space.
Okay.
And then I'm going to place 6, and it goes intercostal space
Yeah.
just under the armpit. Place 5 in the missing gaps here, and 3 in the gap between 2 and 4.
Thank you.
Okay, and I'm
Okay.
going to read that ECG.
So when you do this ECG, there's no obvious ST elevation. There are some T-wave inversion, but it's just a normal sinus rhythm, but with some depression, no elevation.
Okay.
Okay, so, oh gosh, this pain.
So, John, what I'm going to do, I'm going to check my JR calc. You've
Yeah.
got this chest pain.
I have, yeah.
Just going to double check that I'm okay to give you some more medication.
Okay, thank
To
you.
double check.
Okay, what are you going to give me?
So, I'm just going to double check, but I'm thinking of giving you some GTN
Oh, right, okay, I've heard of that.
and
Yeah.
some aspirin as
Oh,
well.
okay, yeah.
Okay.
Yeah.
Have you taken any of those before?
No, I haven't had
No.
anything, no.
Okay.
Good, thank you.
Okay, so
Oh, it does stink a bit, doesn't it?
yeah, I know it must be very, very uncomfortable for you, John. So, just double checking, you've not been sick at all.
I feel sick, but
You
I
feel
haven't
sick,
been
you've
sick.
not been sick.
Yeah.
Bowel movements all okay. There's nothing different there.
No, nothing, no change
Okay,
there.
I can see that you're not jaundiced at all.
No.
You're not on any blood thinners.
No.
No, brilliant. Okay. Any history of asthma?
No.
No, brilliant. Brilliant. Okay. So I'm going to double check the dates on my medication first before giving you any. That's all in dates, and then I'm going to give you 300 milligrams of aspirin. And if you could take this orally,
What do you want me to?
so you can either chew it
Okay.
or I can go and dissolve it in some
Oh, I'll
water
chew
for you.
it, yeah.
That's no problem.
Yeah.
So the pain should be easing now
Okay.
for you, John.
Okay. Okay.
And I'm just going to check this GTM as well.
Thank you.
Just checking your blood pressure. Okay, and I'm going to give you this GTN as well. Okay, so this goes, you pop it under your tongue
Okay.
and you just let it sit there.
Okay.
I'm going to give you 500 micrograms, and it's just going to pop it under your tongue. If you
Okay.
start feeling dizzy, nauseous, any more nauseous than you normally do, let me know. I am going to monitor your blood pressure as well whilst you're on that.
Thank you.
Okay.
Thank you.
And just whilst I do that, I'm just going to calculate a news 2 score.
Okay. I feel like that's helped a little bit.
Has that helped
Yeah.
a bit?
Yeah.
Yeah, brilliant. Okay. I think still a trip up to hospital is a good idea, just because of your history of having that stent.
Yeah.
Just remind me, John, what medications are you on at the moment?
So I take bisoprolol
Yeah.
and I take simvastatin and I take metformin.
When did you have your stents, John?
About 4 years ago.
4 years ago.
Hiya, my name's Louise.
Hello.
Tell me what we've got.
So we've got John. Sorry, John, just remind me of your age, please. 54?
Am I? Yeah, I'm 54, yeah.
Hiya, John. Who's 54-ish?
So John is a 54-year-old male, complaining of central chest pain radiating into his arm. I've administered GTN and aspirin, which has relieved some of the pain. John has had a stent about 4 years ago and he's had angiograms. So I'm suspecting possible MI or in the past, or possible blockages that he's need to have that stent for. We've got a rest rate of 22, SpO2 95 on air, no oxygen given, temp of 36.9, BP of 150 over 90, heart rate of 94. He's been alert throughout on the AVPU scale, GCS is 15. We did try some Entonox at first, but he was struggling to take that in because he was having that chest pain.
Right.
So I was debating whether to give paracetamol. I'm just going to work out the NEWS 2 score for you as well.
Thank you very much.
There's nothing on the ECG apart from some T-wave depression, I think it was. No ST elevation at all.
Okay.
I'm querying maybe unstable angina at this point. If it becomes more unstable though, I think.
And where are we going to rule it out then?
I think we'll go to ED. There's no criteria matching for PPCI at the moment.
Do you want to do a pre-alert? Still in pain?
He is still in a little pain. How's your pain score now, John, once you've taken that?
Still about a 7, and that GTN helped a little bit, but...
Right, okay. Yeah, I think a pre-alert would be the best.
Yeah.
The best.
You need to get your paramedic to do some
I'm going
work.
to say, do you want me to do anything?
I think if
Calm
we
down,
could-
John. Calm down.
What are you? What are you?
I think because of the pain score still, I think morphine would be the best choice here.
I'll get that set up then while you work the news score out, and we'll think about getting him
Thank
to
you.
hospital. I take it you've not been up to anything adventurous last night?
Um,
You've not taken any drugs or anything?
a blue one?
Yeah.
No, I